Okay, so today we are doing medication administration. We have eyes, ears, nasal spray, and inhalers. So our first is going to be the eye drops. So there is multiple ways that you can put medications into the eye. You can do a cream or you can do the drops. Today we are going to be doing the drops. So whenever you go to administer drops, you're going to verify the healthcare's order. You're going to provide the privacy for the patient. You're going to perform hand hygiene. You're going to introduce yourself. So I would say, hi, my name is Taylor. I'm going to be your nurse today. Then I'm going to have two patient identifiers. Can you please tell me your name and date of birth?
Alexis Prayer, 062504.
Okay, thank you. I would verify that with her wristband. I'm going to make sure that she doesn't have any allergies. Do you have any allergies? Okay. And then I'm just going to explain the procedure to her that I'm going to be placing these eye drops in your eye today that your doctor has ordered. I'm going to check the expiration date, make sure everything looks good and it's in date. I'm going to ask the patient, they can either lie down or I'm just going to, in this case, I'm going to have her bend her head back. So if you could bend your head back for me, please. And then to this eye, we're going to be doing it. So I would clean the eye from out or from inner to out. I would just take a gauze pad and some saline. Then I'm going to have my gloves on. And then I'm going to with my non-dominant hand, I'm going to place a gauze pad on her cheek to catch the drops. I would then pull down her eyelid. You can see her conjunctiva sac. I would then place the drops in the conjunctiva, making sure that the tip of this does not touch her eyelid. It doesn't touch her eyelid, and I'm gonna apply the drops. Then after the drops are applied, I will then hold pressure to her nasocranial duct for 30 to 60 seconds to make sure that it gets in there and gets all that medication in there. I would then wash my hands, make sure that the patient is fine, and then I would wash my hands and document. So that is all for the eye drops. Like I said, with the cream, you can also put that and it would just be the same thing. You would just put it in the conjunctiva of the eye. Now we have ear drops. So with the ear drops, you're going to do the same thing. Verify the provider's order, gather your equipment. I would introduce myself to her. I would make sure that it is the right patient. I would ask her for her name and date of birth, verify it with her wristband. Make sure that she doesn't have any allergies, which she already stated that she does not. Then I would get my medication. So this is going to be my ear drops for today. I would then warm them in my hands to room temperature. Then I would either have the patient lie down, but in this case we're going to have her sitting up in her chair. I would have her tilt her head to the side that I'm not going to be putting the drops in. So I'm going to go ahead and have you do that. Still going to be warming these up. I'm going to put my gloves on. And then I would, since she is over the age of 3, I would take her ear and I would pull down the ear canal and then pull it back. If they're under the age of 3, then you're gonna pull, oh, actually, just kidding. If they're above the age of 3, you're gonna pull up and back. For below the age of 3, it's down and back. So then I would pull her ear up, back, and then I would take my drops and I want to be a half an inch above her ear, making sure that it does not touch. And then I'm going to apply the drops that are needed into the canal. I would have her stay in this position for a few minutes until that medication gets in there. And then I would go ahead and gently apply pressure and massage that area. Then I would apply a cotton ball if the doctor says that is fine. And then after that, I would make sure my patient's fine, and I would perform an hand hygiene and document my findings.
Okay. And then we're gonna ask questions like, what have you learned so far after the eye and ear demonstration? And then now we're on to nasal sprays. So with nasal sprays, you're gonna verify the provider's orders. You're gonna gather your equipment, perform hand hygiene, and then you're gonna go into the room, introduce yourself. For nasal spray, we have this. You're gonna check, make sure it's not expired, nothing's wrong with it, it's not damaged, anything like that. So you're gonna introduce yourself. Hi, I'm Alexis, I'm your nurse, and I'm here to administer your nasal sprays. And you're gonna help your client into a sitting or lying position. For this purpose, she is sitting. She is sitting.
Miss Tidwell is now interrupting.
For this purpose, she is sitting. So you're gonna take this off. This is what the applicator looks like. So when you're administering nasal sprays, you are going to whatever nostril, place it in, and then you're gonna have your patient occlude the opposite nostril. And while you are administering the sprays, however many that is ordered, you're gonna have your patient breathe out through their mouth. So, breathe out through your mouth, breathe out through your mouth. Okay. And then after you finish administering the sprays, you're gonna clean this off with alcohol or anything like that. Top it back on. If you first open this, you would date it, whatever the case may be. And then you're gonna perform hand hygiene, make sure your patient is okay, they don't need anything, and you're gonna document that it went well or if it didn't go well. And that is it for nasal sprays. And then we have inhalers, and we have two types of inhalers. So we have a meter dose. I think this is the most common, and it counts how many sprays that you have left after you just used it. And then we have powder inhalers. These dry powder inhalers. These administer powder, and after you administer this, you have your patient swish water into their mouth. So with the meter dose inhalers, again, you're gonna verify the provider's orders, make sure it's the correct inhaler, correct patient, perform hand hygiene, introduce yourself, two identifiers, and explain the procedure to your patient. And then before you get ready to administer, you're gonna shake it 5 to 6 times, and your patient should be able to administer themselves, but you would still need to give instructions if they're not too little. So you're going to instruct the patient to hold the inhaler, and then take a deep breath. Just hold it away first. So take a deep breath and exhale all out, and then inhale slowly deep through their mouth for 3 to 5 seconds. For 3 to 5 seconds, and then you ask the patient to hold this inhalation and then exhale slowly over 10 seconds. And then that is it. And then you recap it. And if you want to keep up with the amount of sprays that that you have left or have used, it's on the back of it. And then for the dry powder, first you're going to, it's kind of the same with the meter dose. You're going to open it, and then you're going to load it up, push it back, and you'll see a number on here. You have the patient, I'm not going to do it, you have the patient inhale the powder, and then you would give them some water to swish around in their mouth. And that is it. Oh, yeah. And then also for the near-dose inhalers, these are things called spacers. And in this case, you would use this for pediatrics or geriatrics. So you would just fit the actual inhaler into this spot, and it's really the same concept. Have them have this on their mouth, inhale, push down, and same thing. And then with this pediatric spacer, same thing. You would place this part on the baby's mouth, well, face, and then you would press down. And that is it. At the end, we have questions.
Yes, we do have questions at the end.